My name is Sean Baxter. I'm the president and owner of Kayser Automotive Group in Madison, Wisconsin, and I want to just tell you a little bit about our journey to self-fund health and self-insured healthcare over the last, I'd call it 5 years. If you're anything like us, the healthcare expense, the benefit you provide your employees is one of the biggest in your company, and it is for us. And in a fully insured model, which was our practice forever, those costs were really running out of control. 15 to 25% increases year over year. We finally said, this is not sustainable. We reached out to the system provider, our health plan, and said, help us control this cost. We're business owners. We know how to control expenses. So show us a path, help us understand what's driving it so we can control these premium increases. The resulting message from the provider and the fully insured model was, we can't help you. We can't give you the data, it's protected, they hide behind HIPAA and all these other things. Basically said, well, you can, cover more of the expense or raise your deductibles or plan design changes that'll help control the cost. And what we were really getting at was the claims cost. That's what we were trying to control, consuming less healthcare. And so finally, frustrated enough, we started searching for alternatives. And we went through probably 3 years worth of renewals with our broker to help us get off this HMO fully insured train. And what we learned was that self-insurance and self-funded insurance is very complicated and to do it yourself. And there's a lot of pieces that have to go into it to make a plan that's going to be successful for us as a company. So it failed for the first 3 or 4 attempts. It was more expensive, it was going to be more risky, and the company just wasn't willing to take on more risk to control that cost. And then, lo and behold, one year we run into this company, this startup company called Self-Fund Health. And boy, was I excited when I started listening to some of the founders talk about what their vision was for the company. But in a sense, they took the complexity of self-insurance under one umbrella and under one solution, and they solved for all the things that we couldn't get right ourselves. And they put a package in front of us that included all the necessary pieces to make self-insurance work. That was finally attractive enough and risky or risk averse enough for us to say, let's try. And so we did. We went all in and switched last year from a fully insured model to a self-insured model with the help of Self-Fund Health. And I can tell you what, the one thing that we were missing in the old model that we got now with Self-Fund Health is control. We now have control over our own destiny. Before, when I needed data or I needed solutions from our providers, I was met with a brick wall. Today, we control the data, we control the solutions, and if I need more information, we have access to get it, and we have the partnership with Self-Fund Health to help us understand what all the numbers mean, and we can be tweaking our plan to make sense. And so it's really been a breath of fresh air. For the first time in really 5 years, as I said, we found a solution that's not only supports our mission of trying to control the cost of our benefit, the biggest benefit we provide our employees, but also giving us the education and the tools to put together a package that protects the company, but also provides us the control and access to make changes on the fly as we need to support our people and to deliver the best, highest quality healthcare we can for our folks. So I'd encourage you, if you haven't considered self-insurance, now's the time, and Self-Fund Health is the place to start. Let them show you what they're doing. Let them explain all the pitfalls of the old model, as well as some of the pitfalls of trying to do self-insurance yourself by bolting on and together all these various aspects. And let them do it and let them show you how it works, and I think you'll be pleasantly surprised.